my name is Leah Christie and I am a student nurse at the University of South Alabama, and today I'll be doing an enema checkoff. So before entering the room, I'm going to perform hand hygiene and I'm going to scan my room. And then I'm going to verify the patient order and the hospital policy and perform hand hygiene before entering the room. And then I'm going to identify my patient using two identifiers. So I see that it is Jaguar Jones and Jaguar Jones, and then the date of birth is August 25th, 1963 and August 25th, 1963. I'm going to assess for the allergies, and I see that it is penicillin and penicillin that he's allergic to, and I'm going to gather all of my equipment, including my bedpan and my IV pole, and I'm going to explain the procedure to the patient and provide privacy, and then I'm going to perform hand hygiene and don my goggles. So now that I've done that, I'm going to prepare the enema bag. So I'm going to take the enema bag over to the sink, and I'm going to make sure that the tubing is clamped, which it is, and I'm not gonna touch the tubing to the sink. And then I'm going to turn on the water and add 750 to 1,000 milliliters of warm water into the bag. And then I'm going to add the soap in, and then I'm going to gently agitate the bag, and then I'm going to prime my tubing and unclamp, making sure that the tubing is working, and it is. So now I'm going to reclamp the tubing. And then I'm going to hang my bag on the IV pole. And then I'm going to perform hand hygiene and put on my clean gloves. And then I'm going to raise the bed to a working height and lower the side rails and position the patient in the left lateral Sims position. So now I'm going to take my dominant hand and I'm going to take the tubing, and I'm going to take my non-dominant hand and lubricate the end of the tubing. And then I'm going to take my non-dominant hand and place it on the patient's hip, and I'm going to spread the buttocks, and I'm going to also, if there was, the patient were to have hemorrhoids, I would have them bear down so that it would facilitate the process easier, and I would have them take slow and deep breaths while I'm entering. So I'm going to hold the buttocks open and secure the entire time while I am inserting. And I'm going to insert 3 to 4 inches, and then I would unclamp, and then I'm going to secure it with my 2 fingers near the rectum, and I would take the bag and I'm going to set it down and unclamp it, and then I would raise the bag 12 to 18 inches, and if the patient complained of any uncomfortableness or cramping, I would set the bag down and lower it, and then reclamp the tubing. So after all of the liquid is out of the bag, I would set it down, and I'm going to gently remove the tubing, and then I'm going to discard, usually in a trash can, but right now I'm just going to set it aside. And then I would have the patient hold the enema for 10 to 15 minutes. And once they are ready to evacuate, I would help them assist with the bedpan, and you would use the larger side towards the buttocks and the smaller side towards the thighs. So you'd put it under there and have them evacuate. And then I would document my procedure, and I would note the type and amount of enema, as well as the time and how well the patient tolerated the procedure. And then I would also document the color and amount of the return, and I would note how the patient was left. So thank you.